Hello students, I am Roslyn Ude, the head of Community Health Officers School of Lagos University Hospital. We are going to look at Community Health Officers' response to newborn infections. Learning objectives. Let's first of all look at the learning objectives. At the completion of this session, you should be able to identify the danger signs of illness in the newborn. Take appropriate health actions to manage newborn infections identified at the community level. Introduction. First, before we go into the lecture, you know, as community health officers in training, that community health officers have both clinic-based functions and community-based functions. And your community-based function is about 30%. So we are going to, in this lecture, we're going to look at some of the things that you do when you are in the community. Maybe through during your follow-up visits, home visits, outreaches, and all that. You are bound to see such cases that will require your attention. Now, newborns can fall sick easily in the first few days of life, and the sickness can get serious quickly. You all know that. A delay in receiving treatment can be life-threatening for the baby. So it's usually something that requires utmost care and should be treated as an emergency. So let's look at signs of illness in the newborn. You know, when you are in the community, you should try during your home visits or outreaches to identify these sort of problems, and then, of course, that will require your emergency treatment. So signs of illness in newborn can be difficult for families to identify, but a trained CHO can assess and identify babies who need urgent treatment. So how a CHO should respond to newborn infections in the community? A CHO in the community setting is expected to identify sick children in the community through home visits or information from the community members, like I also mentioned earlier on, during outreaches or follow-up visits. Now, before you will get this information from them, you have to kind of interview these mothers or take history of a problem that they present to you for you to be able to elicit such problems and then know what to do. And then you're also supposed to provide health education and counseling to mothers on how to manage suspected infections in the newborn at home. And of course, make appropriate referrals to higher health care facility for proper management of newborn infections that cannot be treated at home. And during such visits, of course, you're supposed to manage whatever you can manage there, teach mothers how to care for these children at home, and of course, cases that cannot be managed at that community level should be referred to the facility. Signs of illness in the newborn. We're going to look at some danger signs. The newborn is not able to feed since birth. This could be what you, with kind of information you're able to get from the mother. You know, that the baby has not been able to suck, or have stopped feeding well, okay? Or that the baby had convulsion or fit. This also should be of concern. Then, having elicited this information from them, and of course, you should also do examination. And you observe, if you observe fast breathing, 2 counts of 60 breaths or more in a minute should be an indication that the child is ill. Then chest indrawing on examination. Of course, high temperature of 37.5 degrees centigrade or more, or very low temperature of about 35.4 degrees centigrade or less. Then when you examine the soles, you say that the soles of the baby are yellowish. It should be of concern to you as well. Then movement only when stimulated, except if you beat the child or stimulate the child, you know, kind of is still, you know, should also be of concern to you. Or no movement even on stimulation. Signs of local infection that you may also identify may include the umbilicus is red or draining pus, then skin boils, or the eyes of the baby are draining pus. Okay, these are indications that the child is very ill. So now let's look at how to respond to umbilical cord infection. We look at the signs and then we also discuss how to treat. An offensive discharge over the surface of the cord, that the cord is smelly, okay? It's not a good sign, it's not a good indicator. In such a situation, okay, what should you do? You will check if the infection is localized to the umbilical cord. Neither local nor systemic antibiotics will be needed. If you look at the cord and you see that that infection is only on the surface and there's no indication that it has spread, okay, then you should know that the child will not need systemic antibiotics. The next one is failure of the cord to become dehydrated. That is, the cord remains wet and soft, is not dry. You know, after a few days after birth, the cord should start drying up, and of course before it falls off. But if it remains wet and soft, then it should be of concern to you. The cord should be carefully cleaned with a swab, an adequate amount of spirit every 3 hours. Okay, this is something the mother can do. So you teach the mother how to do that. Okay, every 3 hours to clear the infections and hasten dehydration. The next thing is redness of the skin around the base of the cord. If you observe that, what should you do? If there are signs of spread beyond the umbilicus, e.g. to the abdominal wall, then you should refer promptly to the hospital for intravenous antibiotics. Okay? It's not something that you encourage the mother to manage at home. The child should be referred quickly to the nearest hospital for proper management. And you should also now watch out for signs of tetanus infection. What is tetanus? Tetanus in the newborn infant is caused by a bacteria, Clostridium tetani, which infects dead tissues such as the umbilical cord. Okay? You know, part of harmful traditional practice in our society is treating cord with cow dung and many other unhygienic methods, okay, of using the cloth that may not really be clean or sterile to dab on it. Such things are not hygienic, and by so doing, mothers may infect the child. So, like I said, the bacteria usually occurs in soil and feces. So that is why mothers should be discouraged from such unsanitary methods of caring for the baby, okay, which may be placed on the cord or other wounds, such as traditional, such is a traditional practice that we often speak against. A newborn with tetanus presents with rigid muscles with spasms, excessive crying, and inability to suck or breastfeed. Those are some of the things that you should note. And of course, you obtain this, you receive this information when you interview the mothers. Okay? And then that should inform you on what to do, what action to take. However, tetanus infection can be prevented by good cord care. Okay? Teach them how to properly care for the cord of the baby, the mother of the baby, the grandmother, and every other concerned relation that will come with their ideas. During such home visits is opportunity for them to be taught, for you to give them health talk or health education on what to do, so as to avoid tetanus and introducing other infections to the baby. Now, of course, during antenatal care and during outreaches, pregnant mothers should be told to make sure that they immunize, okay? They take tetanus toxoid when pregnant in order to avoid tetanus infection, okay, in the baby. And also, conducting deliveries in a clean and safe environment will also help to guide against this. Also, during the health education in the community or community outreaches, mothers should be taught it's safer to make use of skilled birth attendants in the hospital. These are ways of avoiding tetanus toxoid infection in children. When they patronize traditional birth attendants, and when they deliver at home, and then they didn't take tetanus toxoid while pregnant, and then poor management of cord, those are part of what should form your health talk or health education messages to mothers, okay, in the care of for the care of newborn babies. How to manage a newborn with tetanus? Tetanus infection should be treated as an emergency condition. Okay, this is not something people at home, they have their methods of caring for the baby, most of which are dangerous and life-threatening for the baby. Some will put the baby's legs in fire and pour oil or liquid and all that. Such should be discouraged. Okay, they should be told that such practices are dangerous, life-threatening, and should be avoided. What they should quickly do is to keep the airway clear. They should make sure that the child is breathing well, okay? And they should not stimulate the infant. And of course, transfer the baby urgently to the hospital. Care of skin infection is another thing that is common in the care of newborn at home. And when you go for such home visits or follow-up visits or outreaches, these are kind of cases that you may see that will call for your attention. The most common form of skin infection in the newborn infant are bullous impetigo caused by the staphylococcus, which present as pus-filled blisters, usually seen around the umbilicus or in the nappy area. A rash caused by fungus, Candida albicans, that yeast. This almost always occur in the nappy area and present as red, slightly raised, velvety rash. Bullous impetigo is treated by washing the infant with chlorhexidine twice a day for 5 days. These are some of the things that you should teach mothers how to do, or while you are visiting. Candida rash should be treated with topical mycostatin cream, and the area should not be covered. You should tell them to air the area, expose the area so that it will not be wet, so that it can dry up and the Candida rash will be healed quickly. Care of oral thrush. Oral thrush, that's candidiasis, is caused by the fungus Candida albicans, which may also cause skin infection. It presents as patches of white coating on the tongue and mouth of babies. Okay, so you should look out for that. Unlike milk curds, sometimes seen after a feed, thrush cannot be easily wiped off. Okay, so that they shouldn't mistake that for leftover milk in the mouth. Okay, so these are the things you should point out to the mothers. With mild infection, there are only scattered areas of thrush. The infant almost sucks well. Mild thrush is very common, especially in the breastfed infants. Mild infection does not need to be treated, usually clears on its own. With severe infection, there are extensive areas of thrush in the mouth. The tongue and mouth are red, and the infant feels poorly due to a painful mouth. The infant appears miserable and may lose weight or become dehydrated. Okay? Now, what do you do? Treatment is 1 drop of mycostatin drop, that's nystatin, into the mouth after each feed. So you should teach the mothers what to do and how to manage this situation. Or mycostatin ointment wiped onto the mouth with a swab for 1 week. In conclusion, community health officers are an essential part of the comprehensive primary health care system. The role in the identification of newborn infections, particularly in the home setting, cannot be overemphasized. Signs of serious illness should necessitate prompt referral. Okay? Then follow-up visits, counseling, and promotion of medication adherence are all key roles of the CHO and other community health workers. Thank you.